Hi, everybody. My name is Dave Lisk, and I am the Vice President for the NRC Industrial Research Assistance Program. Welcome to today's panel, number 9, Roles and Responses of National Research and Technology Organizations and Innovation Funding Agencies in Pandemic Times, the Global Experience. We're very happy to be here and leading this panel today because COVID-19 had a significant impact on everyone around the world, and governments across every nation have stepped up quickly to make changes to support the situation, fight COVID, and protect their citizens, and also to attempt to sustain their economy and a plan ahead for a recovery. Today we have both RTOs and innovation agencies who have played important roles in this regard, serving to pull science, technology, and innovation ecosystem players to work together to address the challenges. ST&I will be critical to finding solutions to address the pandemic and the future recovery and accelerating towards a greener and digital future. This morning, I'm very pleased that we're going to hear from the experiences and insights from government organizations from Germany, the United Kingdom, and Taiwan, along with Canada, and also the direct experience of a small SME company and its pivots and changes. So many thanks to everybody who's joining, especially to those who are in significantly different time zones. So today, the panel consists of Melanie Cullins, the Executive Director of the International Innovation Office for the National Research Council. She'll present the experience of Canada and the NRC perspective. Mr. Milton Deng, European representative of the Industrial Technology Research Institute, and he will present the experience of Taiwan and ITRI. Verena Fennemann, European Research Area and Director of the Fraunhofer EU office in Brussels, who will present the experience of Germany and Fraunhofer. Mr. David Golding, Head of North America and Global Networks of Innovate UK, who will be presenting the experience of the United Kingdom and Innovate UK. And finally, Mr. Will Rowe, President and CEO of Nutrasource Pharmaceutical and Nutriceutical Services, a recipient of support from NRC Industrial Research Assistance Program, and he will share his insights and experience through the pandemic and working with government programs. So we'll now be going through to a series of presentations from each participant, and we're going to start with Melanie Cullins.
Great, thank you, Dave, and good morning and good afternoon, everyone. It's a pleasure to be with you today, and thank you for the opportunity to speak about the NRC experience. To set the stage on Canada, to the right of my slide are a few bullets on the COVID-19 impact from an economic perspective. As you can see, service exports have decreased significantly, oil and gas investment is down, and employment continues to be impacted. Supply chains have been disrupted, including agriculture and manufacturing, due to border closures. And we're experiencing shifting industry dynamics, models, and practices. Impacts are uneven throughout sectors and regions, with industries like air transport, accommodation, and food services hit hard. On the other hand, we have some areas of strength. And while not noted on this slide, we see opportunities emerging in areas such as e-commerce, cybersecurity, and digital. In response to the crisis, Canada's Federal Economic Action Plan has mobilized over $200 billion in direct support both to businesses and individuals, $25.6 billion in protecting health and safety, including public health response, medical research, and vaccine development, and $85 billion in indirect tax liquidity support or deferred taxes. $686 billion has been moved into indirect liquidity support. And within this response, Canada has set up a number of federal committees including, but certainly not limited to, a cabinet committee on the federal response to COVID. We also have a committee on industry strategy, a green economic stimulus manufacturing, and a COVID-19 expert panel with our chief science advisor. Industry has been mobilized throughout to rapidly scale up or to retool manufacturing, including for personal protective equipment, sanitization, diagnostics, testing, and disease tracking. Direct support for SMEs has been provided through a number of tools, including a Canada Emergency Wage Subsidy, a business account, and of course, the Innovation Assistance Program, which I will speak to later in the presentation. Throughout recognizing the needs, there's been a focus on domestic capacity building, innovative solutions, and procurement of essential supplies. Next slide, please. To help situate the National Research Council within the Canadian landscape, NRC is the largest federal research and development organization in Canada. And NRC partners with Canadian industry to take research impacts from the lab to the market and where people can experience the benefits. We have three key areas of focus: policy solutions for government, research, and business innovation. NRC spends over $1 billion a year and has a national and international footprint with a presence both in Germany and Japan. We're unusual in the international landscape due to our role both as a research performer as well as an innovation agency supporting small, medium-sized enterprises. The National Research Council Industrial Research Assistance Program, or IRAP, seeks to stimulate wealth for Canada through innovation by providing direct support, advice, and networks to small, medium-sized enterprises, which in Canada are firms of under 500 employees. And NRC's research addresses emerging technologies through to life sciences, advanced manufacturing, transportation, digital, and engineering. With over 2,000 scientists, engineers, and technicians, as well as 266 IRAP industrial technology advisors on the ground, connected directly to our innovative SMEs, we're responsive, creative, and uniquely placed to partner with Canadian industry, universities, and our international collaborators to invest in strategic R&D programming that addresses critical issues for today and the future. Next slide, please. The new framework that NRC has adopted to address COVID-19 is threefold: protecting our people, protecting the health of Canadians, and supporting our clients and collaborators. As of 27th of March 2020, 90% of NRC employees were off-site. Today, we're allowing up to 30% of people on site where it is strategic and where they're also helping to support the off-site work. And within that scope, we're also piloting innovative ways to keep people safe, looking at thermometry and other tools. However, telework does remain our default position with 70% of our team working off-site. And this has meant a fair amount, as all of you have dealt with, of work in terms of VPN expansion and making sure we have the right tools in place so people are able to work at a distance. And this extends right through to looking at mental health support because of the changes in this environment. And we have addressed as well, where necessary, a scope when we do need to visit clients, work with collaborators to ensure that we have put in place the right operating procedures for our team, as well as those we're working with, to be safe while working together during this pandemic. When it comes to protecting the health of Canadians, NRC is applying science and technology to COVID-19 challenges. We serve as the Secretariat for Canada's Vaccine Task Force. And we're building a new biomanufacturing facility to support manufacturing of vaccine candidates for emergency use, once we do have an approved vaccine. This will help ensure access and supply for future vaccines, good manufacturing processes for large quantities of vaccine, all the while helping to grow and support Canada's biomanufacturing production capacity, knowledge, and storage. In addition, we're scaling up our clinical trial manufacturing facility in Montreal to develop and scale up processes to produce COVID-19 vaccine candidates. And once available, it will produce up to 100,000 doses per month. In addition, we've created a new pandemic challenge program to connect the best Canadian and international researchers to fast-track R&D aimed at solutions. The pillars here are rapid detection and diagnosis, therapeutics and vaccines, digital patient care and analytics, as well as enabling adaptive responses to validate and test innovative solutions. On the clients and collaborators front, I'll say a few words about what we have done to help SMEs. And within that, IRAP has actually mobilized a challenge procurement program with a number of different challenges areas together with Innovative Solutions Canada, addressing possible solutions for low-cost sensors, diagnostic kits, and 95 mask filtration, through to intelligent data, magnetic reagents, and we're looking at new challenges. In addition, IRAP mobilized the new Government of Canada Innovation Assistance Program, which is a wage subsidy program that is put in place to help innovative early stage companies unable to access the other tools available. And with this, we've already mobilized almost 250 million since April, and another 155 million was announced last week, or a week and a half ago, I guess, at this point in time. So on top of that, because of my international hat, I will mention that we also mobilized a group of 12 countries around a COVID-19 co-innovation action plan response to put in place projects with the Eureka platform. And that we've done 2 calls to date, and we're starting to initiate projects. Next slide, please. So Canada, alongside most other economies, is currently in an uncertainty phase. Okay, so this is a period of oscillating public health controls and unpredictability. So in terms of forecasting, it's difficult to predict exactly what Canadians might experience, but we're hoping to enter into a new normal where we'll still face challenges. And NRC is putting time into thinking through what the scenarios might be and how we can best provide solutions. 3 key areas where we will focus, and I know my time is tight, are on health innovation. So looking at healthcare to address the current pandemic, but also looking forward, because it's quite clear that healthcare innovation is going to be both an economic and societal driver for Canadian prosperity and security. And we want to be ready for future pandemics, but also other challenges such as aging and change in demographics. In addition, we'll continue to strengthen the relationships that we have built during this pandemic across federal departments and agencies to better support the development of Canadian PPE products and to strengthen the supply chain. And that would include standards and certification and sterilization and reuse of PPEs. Digital and IC transformation is a second area where we anticipate a very significant focus. COVID has certainly highlighted the urgent need for digitalization, and our firms will need to increase their investments in digital technologies accordingly. And a third area of focus for us is around sustainable economic recovery or green growth. And here we've got a broad range of initiatives planned and that we're considering for the future around a low carbon economy, including sustainability, reducing greenhouse gas emissions, climate change adaptations, and we're looking at supporting SMEs in sectors such as hydrogen applications, alternative fuel applications, advanced electric motors through to zero emissions. And on the research side, an example of where we're working is reducing the carbon footprint of Canadian buildings through decision-making tools and resources aimed at reducing our operational carbon in houses and buildings. So next slide, please. So this link will take you through to a very good summary of all of our work in terms of fighting against COVID-19. So I would encourage you all to take a look at that and to keep an eye on our pandemic challenges and other challenge programs where there could be opportunities to collaborate and engage. So thank you very much. Merci.
Thanks, Melanie. Without further ado, over to Milton for his presentation on Taiwan.
Okay. Thank you, David. Can you hear me? Yes. Okay. Okay. Let me start with my presentation with a lesson that Taiwan learned from the SARS pandemic 17 years ago. As you can see here, Taiwan is a small island and very close to mainland China. The distance between the two regions can be 125 kilometers at the least. So with this tight geographical relationship, Taiwan really paid a high price in the SARS pandemic in 2003. We lost 73 lives at that time, which amounts to about 10% of the global death. That's a lot for a small island country. So what we learned from this tragedy is whenever there is an alarm, respond to it as soon as you can. The next slide, please. Okay, as early as January 2020, this year, when the Taiwanese government became aware that an abnormal and secret disease was spreading in China, they immediately activated the Central Pandemic Command Center for monitor and coordinate national actions. Our government imposed several crucial prevention measurements, including closing the border, enforcing face masks wearing, and also the social distancing. By doing so, they avoided a mass lockdown in our country. In the meantime, the government announced an economic stimulus package worth 35 billion US dollars. They launched the, for example, the economic stimulus vouchers that every citizen pays only 33 US dollars and gets a voucher which with a threefold value. This package proves to be very successful. The derived domestic expenditure has been estimated as high as 330 million US dollars. Yeah. One good example is the booming local tourism that most of the hotels in the recreational areas have been fully booked since July. As you can see this picture here, this picture gives you an idea of how the tourists flooded in a small island called Penghu during this summer. Okay, next slide, please. This slide shows Taiwan's government succeeds in balancing the protection of health and our economy. They even envisaged a positive GDP growth this year. Here's an update on the situation in Taiwan. Until yesterday, November 15th, there were only 602 confirmed patients and 7 deaths within the island, which comparably is very low to the world. Next slide, please. Okay, this slide gives you an overview of our organization. We are the Industrial Technology Research Institute, the largest applied research institute in Taiwan. We have more than 6,000 employees, and we strive toward the following three vision: the market-oriented R&D, and bridging research and commercialization, and we want to be the powerhouse for the industry. Next slide, please. Okay, at the beginning of this pandemic, ITRI implemented a number of pivotal activities to protect our employees and keep the operation still running, such as we scatter the workplaces, enhance the digitalization, and ban overseas travel, and maintain employees' physical and mental health. So far, there is no confirmed case among our 6,000 employees. However, we also face some financial challenges this year. We expect a 3% revenue drop this year comparing with last year. For next year, I think we will need to sign more industrial contracts to cover the shortage of the backlog. Yeah. Next slide, please. As I said, ITRI is a national research institute, so we are dedicate ourselves to helping our government fighting against the pandemic. To give you a few examples here, we support the national face mask production team to increase the daily production by 8-fold within only 3 months. Which is very crucial for every citizen in the country can get the face masks in timely manner to protect themselves. In addition to that, we also developed some novel technology to help either monitor or test the disease. Among them is as you can see the picture here, is a precise, fast, quantitative PCR system. It features a small form factor and weighs only 600 grams. The test time takes only 40 minutes, which is a significant improvement compared with normally the 2 to 4 hours of the testing time for the commercial system. ITRI also supports the industry by providing some online training courses and assisting the government in designing a suitable funding scheme, as you can see here. Yeah. So next slide, please. This is my last slide. Looking forward, we expected the industrial income would most likely decline, and the growth of the research funding from the government will be also limited in 2021. However, at this particular moment, we found it as the best timing for a transformation. Therefore, we update the technology roadmap to adapt to the new normal, promote our technology valorization, expand international cooperation, attract talents, and reshape our culture to be a more friendly workplace. That's my presentation. Thank you, and I'm happy to answer any questions in the discussion later. Thank you.
Thank you, Milton. And
Yeah.
we're going to move from Asia to Europe with a presentation from Verena for Germany. Over to you, Verena.
Thank you very much. So it's a pleasure for me to be here as well. I say rather good evening from Europe. Can you go to the first slide? I mean, I keep it short. I guess everywhere it's the same. We had quite a significant drop in GDP since the last decade. So I guess all the countries have experienced that. And which is also very important for us is the drop of tax revenues, since we are a partly publicly funded organization. So who doesn't know Fraunhofer? Fraunhofer is Europe's biggest organization for applied research. So we have around 28,000 employees all over Germany, Germany and also parts of Europe. And so what we see is the drop also in the tax revenues, which makes, of course, for organizations such like Fraunhofer a bit difficult because of the public funding. Next slide, please. So in terms of the impact on RTOs of the pandemic in Germany mainly, but also over Europe, is that, of course, we had, due to a lot of people going to home office, teleworking and whatever, we had, of course, some impact on the research itself. I mean, some researchers, or the researchers who have to work mainly in the laboratories, they of course couldn't conduct their research, but also in terms of travels, meetings, conferences, all those things. I think everyone has experienced that, which was on the one hand not too bad because of virtual meetings and whatever, but of course also the work-related cooperation has become a bit more difficult for the researchers themselves. For us, lucky enough, no immediate impact on the public funding for research in 2020 and 21 will appear, because budgets had been fixed even before the pandemic. So these were assured. But maybe to better understand why the pandemic and also tax revenues and the economic situation is difficult for Fraunhofer, I would like to briefly explain our financing model. So we get 30% basic funding from national and regional governments. We get financing from contracts with industry. And we get, of course, we apply to public project funding in Germany or even in Europe. So for us, it means that the economic recession will have consequences in terms of the collaboration with the industry. And for us, we experienced the first drop in this cooperation, mainly as from 2021. So because for the time being, projects have not been cancelled or so, or let's say not to a big extent, but so the big drop we will face next year, but we don't know yet how much it will be. And we are a so-called private not-for-profit organization. So whatever we get as a surplus from our projects, we can use for internal research programs ourselves. And for the main challenges with the crisis for us were at the beginning, very short-term retain competencies and know-how in-house. So we were really afraid that our researchers would leave us, and also in the German industry. We try to keep the know-how at the highest level. And what we see mid and long term is that we need to secure Germany's and Europe's technological leadership and what we call technological sovereignty. So I will come to that later. Next slide, please. So what we got is also a national stimulus funding, which includes also, I mean, I wouldn't go through all those different aspects, but it includes also supplemental budget for non-university RTOs, so for the research and technology organization, with 400 million euros each in 2020 and 2021, which have to be spent quite soon in both years. Very short-term competitive calls. And so this means also a stimulus from outside. And there were some strategic topics on high-performance computing, for example, climate and environment, materials, hydrogen technologies, and of course, medical research, all mostly focused in the area of COVID-19. So the next slide. What we could do internally is, as I said, we have to use our surpluses internally for internal programs. So what we did is we started immediately with reshuffling internal budget for programs which had been there already, and we stopped these programs and put it to an anti-corona research program at the very beginning, very short-term developments. A bit further on, we try to think a bit more long-term perspectives, and we had this so-called innovation push program. And whereas the anti-corona, the very short-term program, anti-corona research program, was mainly focused, of course, on the direct impact on the corona pandemic, like laboratories, drug research, AI for using public and for informing public and authorities. The innovation push program was more focused on solution and transfer to industry, because we see it also as our task to promote the restart of the economy in the future. So these topics were mostly focused on topics like climate neutrality, recycling management, digitization, and resilience engineering. So this we did together with our research ministry. And of course, we had some external activities together with Munich Re. It's an insurance company, and we worked together with other companies on the German Corona app, and of course some publications on coping strategies for the COVID-19 pandemic as a joint paper with other research organizations. Yeah, next slide, please. I think we can skip this or make it very short. We, together with the World Association of Industrial and Technological Research Organizations, WAITRO, we developed the open innovation platform Zaira, and this is mainly a cooperation platform for RTOs, and this will be relaunched also in December for open calls and for exchange on information about COVID-19. So maybe you will hear in the future from us via WAITRO and the Zaira platform, and we invite all RTOs to cooperate via this platform as well. And the last slide, please. So maybe in terms of what are the strategic directions and strategic topics for us to work on in the future, I guess we heard some from some colleagues. They mainly focus on COVID or medical research. For us, it's of course to focus on green and digital change, resilience issues, and a bit more strategic orientation of research policy, what I was mentioning earlier about technological sovereignty, so that we see that we keep technology, knowledge, experience, and also value chains in Europe, where we see like kind of strategic importance for the future, so that another pandemic or whatever catastrophe might not hit us as it did now. It's not that we want to be completely autark. It's just that we see more options to tackle pandemics or other catastrophes in the future. And for us, strategic topics would be, for example, hydrogen, the energy supply and sector coupling, quantum computing, health, of course, health research, digitization, and resilience topics. So that's from my side. Thank you very much.
Thank you, Verena. And now moving over to the United Kingdom, and David will share the experiences in that country.
Many thanks, Dave, and good morning, afternoon, and evening to everyone wherever you're based. Next slide, please. So really, a little bit about, I suppose, the context in terms of the UK. So I think in terms of COVID, I think we've really seen an unprecedented response from UK government. I think last time, 2008, financial crash, there's a lot of financial stimulus put in place, but this really sort of goes way and above anything which happened in 2008. I think we've seen over 190 separate measures put in place, and somewhere in the region of £210 billion of funding committed, and I think probably even more than that. One of the key things really has been a job retention scheme, where we're seeing roughly around sort of 80% of salaries up to £2,500 a month covered, and that's really been important in terms of just making sure that people stayed in jobs and had a job to continue once we get beyond the current situation. We've seen a lot of loans to somewhere in the region of 1.4 million businesses, and something in the region of £62 billion. And that's, again, been really vital in terms of supporting cash flow of companies, which has been one of the biggest issues. I think for Innovate UK, which is the UK's innovation agency, and I'll talk a bit about that in a minute, one of the things we saw was a lot of the loans being put into businesses and being made available by government weren't really supporting those types of companies. And so we put in additional funding, which is really the 1.25 billion for innovative firms to really overcome some of the challenges, particularly for earlier stage businesses who may not necessarily have a financial track record. And then around 360 million pounds for universities, and a lot of that was really to cover the gap for a lack of foreign students coming into the UK. But what we have seen, I think, is a big drop in unemployment rate. So it's gone down over 4.5%. And really, I think also we've seen, some sectors impacting much more, particularly, I suppose, hospitality and those types of sectors which you would expect. But I think we've seen the biggest drop in GDP, so dropping a huge amount. But we've seen also that bounce back a little bit, but clearly not as much as everyone would like to see. Next slide, please. So I talked about Innovate UK. So Innovate UK is part of the UK Research and Innovation since April 2018. So it's an organisation which brings together all of the funding councils in the UK. So it has a budget in the region of £8 billion, so roughly 13 million Canadian dollars, and a staff of nearly 7,500 people. So, a really big organisation bringing all those people together. Innovate UK is one of the 9 councils, and so we're very much the business-facing part of that, really supporting grants and loans for R&D and innovation projects, as well as advisory services. So we have in the region of 300 advisors on the ground, very similar to the IRAP programme. We have networks and centres, including our catapult centres, which very much modelled on actually Fraunhofer and ITRI. So good to have all of those sides represented today. Melanie also mentioned Eureka earlier, so we're part of that programme. And very much working closely with Canada, very much one of our priority countries. And I think that's really vital when actually you get into situations like this where a lot of sharing of information is really vital. Next slide, please. So in terms of major responses, very much from early March, all staff went to remote working. And I think one of the comments made by one of my colleagues was actually, what we've achieved probably would have been very difficult had everyone had been in the office trying to find a meeting room. So I think just some of those challenges would have been quite difficult. But there's been a big response on vaccines, so you're probably seeing a lot of discussions in the news around some of the vaccines being developed. But you can develop the vaccine, but actually you also need to manufacture, so the sort of fill and finish parts of vaccines. And so we were already building a vaccines manufacturing and innovation centre, and that's been brought forward 12 months, really to sort of ramp up the capability in that area. There's a lot of work went on in ventilators, so we were bringing together Formula One teams, catapult centres to actually build ventilators, and I think that's part of the organisation's convening power, bringing people together, and also using our networks to identify potential suppliers for PPE and other areas. And really helping businesses, and what we termed really was survive, stabilize and grow. So can we manage the cash flow with companies, providing grants or loans or bringing forward payments? Can we stabilize the situation, and can we get them back to growing as quickly as possible? And that was very much what we were looking at doing. So the first competition we ran for £50,000 grants, we had 8,600 applications, which is more applications than we have in any 12-month period. So huge response. We've seen over 1,500 projects supported. We've also recruited another 120 advisors, just bringing all of those people around to support companies. And it's really been, I suppose, the daily insight also we've been getting from those advisors, which has been vital in terms of how we modify and change our programs to a very rapidly changing situation. Next slide, please. So looking forward, number of different scenarios. Clearly for the pandemic, the timing of a vaccine is going to have a big impact on a number of those scenarios. And in terms of, hopefully not for lots of further waves, if we can manage that. But also, the other big thing we are looking at the moment is the relationship between the UK and EU. And again, looking at managing both of those things at the same time, which is not necessarily easiest for companies. GDP predictions, somewhere between 4% and going up. So we'll see how that goes. Not necessarily that clear at the moment. What is happening though, the government has produced an R&D roadmap in July, setting out really a strong ambition. And that looks at increasing public investment in R&D and innovation to £22 billion a year by 24-25. And that's very much still planned. And we'll put a big injection into science innovation in the UK. And that's very much around, can we reach 2.4% target by 2027 for GDP? One of the other big agenda items is really about levelling up and looking at really how we support companies across the UK, but equally how we spread the economic benefit across the UK. Excuse me. And we're also looking clearly at building more resilience into businesses and supply chains. How can we shore those up and make sure they're much more effective going in the future? And really looking at how we get businesses back to growth and scaling as quickly as possible. Very much looking at the scaling agenda, which has been a challenge for us. We've got lots of startups, but getting those companies to scale is more difficult. But all of this really, I suppose, couched in a green growth agenda. So let's sort of build back better, as the term goes, but actually do that in a very green and clean way. We're clearly looking at how we operate in a virtual world. So meetings, missions, conferences. I think the big challenge of that we're finding at the moment is, how do you engage people in a very different way than perhaps you might in a face-to-face situation. But I think what we see is that science innovation is key to locking many opportunities, whether it's vaccines or other areas. And so, I think the investment into science innovation is key to go forward. Thank you very much.
Thanks, David, for that. It was very, very helpful. And now I think we'll move back over to Canada, and Will share his experiences from a corporate perspective. Over to you, Will.
Great, thanks, David. First slide, please. Maybe I'll pass it down here. So just a bit on Nutrasource first before we go into specific reaction responses and planning around COVID and our relationship with IRAP and other government programs as part of that process. Nutrasource is a global services provider in the areas of clinical, CRO type work, regulatory and strategic solutions consultation, and analytical, bioanalytical testing and certification support for the worldwide health product industry, from food to pharmaceuticals. And we've provided that service platform over 20 years. We're based out of Canada, but the majority of our work is for international clientele looking to access the US market, the EU market, South America via Brazil, China, India, and Japan. That's the bulk of our work, is all the science, regulatory, evidence, research, and data to support those areas so that our customers, regardless of where they're from, can launch products around their claims and positioning on side with regulators, but uniquely positioned in a way that allows them competitive advantage in the marketplace. So specific for Nutrasource in that context, as a Canadian-based business with international tentacles, if you will, we've been a long-standing benefactor of various IRAP grants, whether it's smaller type recent grad grants for hiring in a more expedited way, or if it's for some of the larger project grants that IRAP provides. We've had a long and strong track record of working with IRAP to help our own internal R&D to eventually service our clients across our service platform, or to create service packets and packages that our clients find attractive. We've done that in a point of care testing way, as well as for some of our certifications in developing non-GMO detection type testing as well. And IRAP's been instrumental in supporting that. We could not have done that without IRAP historically. And what COVID's really done for us as a life science, biotech, service and strategic solutions provider, COVID's accelerated some key trends for us in the CRO and testing-based certifications world for the industry globally. So whether companies developing a vitamin D, vitamin C, or a hand sanitizer, or a medical device that's to support prevention or treatment of anything related to COVID or any of the symptomology associated with COVID, there are certain trends that have really moved quickly in that respect. And what we've seen is, particularly on the growth side of our industry, is that innovation has really flourished. One of the silver linings of COVID for the global health products industry is how innovation has flourished, particularly in anything involving immune function, both on the prevention and the treatment side. And there are certain nutritional areas, such as vitamin D3, whereby depending on the dose, duration, and patient population targeted in the health claim or the marketing associated with the product, it may be a pharmaceutical drug, it may be an OTC, it may be a natural health product. So these are all considerations, but this type of innovative work is really flourishing globally. One of the other areas that we really saw as part of the industry is we had a lot of major projects in Q2 and heading into Q3 delayed or deferred. But the important thing was that for us, they weren't canceled outright or shelved outright. So what we saw from the global health products industry is a massive pivot or paradigm shift from other areas associated with human health or animal health in food, nutrition, and pharma to immune function. And that could be immune function associated with so many different aspects and variables that really fractionates out from there. Anything to do with health associated with prevention or treatment, associated with any aspect of immune function, even things like gut health, sleep, anxiety, and stress management. There's been such a pivot and trend for us. And we've seen from the global media outlets that do the market research on our industry, across the board, 12% growth. So I think some of the innovation or some of the R&D investment that's been discussed today, although there's been this dip, overall, I think one will see a huge resurgence because of how these companies are in consumer products groups for sure, CPGs, pharma, companies that play in both Nutra and Pharma, this big shift has occurred. Next slide, please. So one of the big shifts is, in order to support the claims associated with this product innovation, is around decentralized studies. So the FDA and Health Canada, we're already warming up to decentralized trial models for substantiating safety and efficacy for certain claims around health products. And COVID simply accelerated that, whereby companies and sponsors, they need the human data, they need to test their products out and conduct the R&D, but showing up to a clinic in the middle of a pandemic, it makes recruitment very tough, and there are many issues that are brought in by COVID that need to be managed. So in many areas of cognitive function, mental health, areas associated with sleep, the gut microbiome, and related studies where stool can be collected from home. There's been a big push to what we call decentralized or remote or virtual studies. They're still as complex, they still need to be managed to the same level of quality, but it is a shift from multi-center studies or single site studies where the patient shows up at the physical clinic. It doesn't work in all applications, but it's certainly a trend in many of these core areas where one can do this type of work with the patients in their home environment. And that's been really good. The other aspect of all of that is there are many federal programs offered through the Government of Canada, through IRAP, NRC, and some other funding streams that have allowed many companies conducting this innovation to access these grants. And we've been the benefactor of that because of the service provision side of our business. So the hand sanitizer industry, the surface and surfactant sanitizer industry has never been healthier from an innovation side. And that's where we play a role, and companies can access our platform accordingly. As part of that, we've seen IRAP extend deadlines for us in terms of how we draw down on our claims, which they've been very flexible that way, and that's been very much appreciated. And we've also shown that, we've also seen that IRAP has reset itself in terms of parallel granting. Typically with the larger grants, when one is a recipient of that as the funded company, or as the lead funding company in a consortium, if it's a consortium situation, you typically get year one. If you get funded, you have year one, but they're typically very little stacking or layering because they want to distribute across the board as much as possible. So that's another area where IRAP has been more flexible, particularly around the Eureka program that we've been a benefactor of. And that's been very beneficial both for us, for our work, and for our clientele looking to accelerate innovation around health products associated with COVID and immune function. And I think the other big thing that our clientele is seeing is because of how Canada, as part of the G7, has managed COVID to date. And I realize over the last 2 to 3 weeks, there's been a bit of a resurgence to a large extent in many areas of our country. But overall, Canada is seen as a safe, transparent, high quality environment and favorable regulatory environment to conduct scientific research. And COVID's illuminated that further, especially with the either real or perceived management of COVID in other countries. Canada is seen as a favorable work environment and for this type of R&D. Next slide, please. So my last slide here, the following 3 points. I think looking ahead past this, even if there's a resurgence, depending on how these new vaccines, and we probably all saw the news today about the second one that's been announced at more favorable storage conditions, there seems to be a lot of momentum there, which is favorable, which maybe will help normalize things sometime into 2021. But in parallel to that, I think what government has been able to prove to itself from a government industry programs point of view is that when it's aligned and when it's incentivized and when certain barriers are shifted or reworked, government and industry can work quickly together to mobilize support for innovation. We've now, as a collective, proven that to ourselves, and that's, I think, both important and significant. I think that COVID-19 in itself needs to be viewed and seen as an advanced flu, where the life sciences needs to build the necessary processes, precautions, and infrastructure in place on the prevention side, now more than ever, and not just try and catch up on the treatment side. Such situations could roll out at any time again, 10 years from now, 30 years from now. There seemed to be a lot of defunding, regardless, not again the political stuff, but regardless of who is in power, there seemed to be a lot of defunding of these core responses to pandemics and outbreaks and how to control them and how to contain them. And I think all countries overall, between government and industry, need to up their game in terms of preparedness in this respect. I think the other very interesting part of this is COVID's been highly politicized in many regions and many countries for different purposes, but ultimately the science and how industry is funded really needs to tackle the core macro issues associated with these pandemics, and it has to be around proper statistical modeling. So if cases are going up, what does that actually mean in terms of how the public is informed, how public policy is shaped, and what innovation needs to occur in order to support the public making informed decision for themselves and their family. And that helps with informed awareness, because we have to watch the fear factor for consumers, but we also have to give them proper information and keep them informed. And that's a very, very tough balance, and it's a very fine balance. I think there's a lot more that can be done in that respect, so that certain headlines aren't just willy-nilly thrown out there into the marketplace, causing confusion, causing undue stress and duress. People need to be stressed, and they need to feel duress and pressure around COVID, so they act responsibly, but not to the point where they become unproductive or are in the fetal position wrapped up in the corner of their living room. That's not effective or efficient, and that doesn't help individuals either. So it is a fine balance, but government, industry, innovation, and support around the right projects to deal with a large swath of the macro issues in COVID or other pandemics future looking are incredibly important, and this has just borne that out. Thank you so much.
Thank you, Will. That's great. And now we're going to open for questions, and if Anna can reorganize the screen, and we'll see what questions we've received. Okay, so I think we have about a short 20 minutes left. I think what we'll try and do is open up the questions, and maybe, David and Verena, maybe you could take this one. So the question is around pivots. Both of your organizations came into calendar 2020 having a plan and series of actions, and that has not completely, but it's been adjusted significantly. And it's not what you did, it's more about how you did it. So maybe if you could, David, you could take a few minutes and describe what changed inside the organization to allow you to pivot.
Yeah, happy to. I think the key thing which happened is just you had a lot of people who were doing particular jobs all of a sudden doing different jobs, because you had to mobilize people against all of the challenges which really existed for the organization. And I think having flexibility in the workforce was really vital. So I think that was one key thing. I mentioned we've got all of the advisors on the ground, similar to you have through IRAP, Dave, and I think again, you can mobilize people and get them to change much more quickly than you can programs. And so again, actually having people working directly with companies and understanding the needs of those companies, and then responding in the best way you can to those companies, particularly helping to navigate the plethora of government schemes that were coming out at the time, was really vital. So I think that flexibility and agility is really important. And I think then the other key thing really was having support from government. It perhaps didn't come as quickly as we would have liked, but it certainly came. And having the ability then to actually put some money and some traction into some of the programs was really keen in terms of pivoting the organization. But I think a lot of it just does come down to the goodwill, flexibility, and the ability of the workforce in the first place, actually.
Thank you, David. And Verena?
Actually, for us, it's the same thing. Like a lot of flexibility, close cooperation with our funding ministry. So they. I mean, of course, we are in the good position that we can use some internal budgets flexibly. So this is what gave us a bit of, own research agenda. We could really deal on our own, but also the close cooperation with the funding ministry and flexibility. And I think what I really appreciated is a super inventive spirit and flexibility of our researchers who really jumped in, in the challenge and took over. And they had really, I mean, from the researchers' perspective, they had so many good ideas that it was really stunning for me how much new things we developed in such a short time, be it on the Corona or COVID-19 challenge, or even on new topics for, restart the economy. And a lot of people, either or on both sides in the institutes, but also in our headquarters, had really the unconditional and untiring commitment to do that. So I could see that so many people were working so hard to make it all happen, that it was also a huge effort of the people themselves. So this was a great effort. So it came intrinsically, let's say.
Thank you. So it's in both cases the creative juices were released, and now as we hope that vaccines are on the near horizon, maybe for Melanie and for Milton, a question would be, how do you build on that? What are the thoughts in your organization to keep some of the best that have arrived in this process? And looking internationally, both Canada and Taiwan are export-oriented, and how do you look internationally to collaborate more? So Melanie, any thoughts?
Great, thank you. I think the first point I would make is that what we have learned through this process is that when there is a need to collaborate, we are able to do so. And when there's a need to move quickly, we're able to do so. So I think part of what I hope we'll take away in terms of best practices will be a really good look at our platforms, our ability to engage, and how we can keep the agility moving forward. It's quite clear that no one's going to solve something like COVID-19 alone. So the rationale for engaging internationally is quite clear. And I think anytime you are looking at a collaboration, you need to have that rationale. So whether it's to access supplies that you wouldn't otherwise have, certifications, a pool of individuals for clinical trials, through to really a co-innovation challenge looking at new markets in the long run. And so it was interesting in doing this. Many of our platforms were very, very effective and able to be moved quickly. I think of the Eureka platform, in which we work with Innovate UK, in fact, which was moving really at, I wouldn't call it a slow pace. I think it was quite quickly, but it was able to move really, really quickly with COVID. We were able to mobilize 12 countries in a few weeks to a joint effort. So I hope we'll be able to take that away with us. The other side of that is within Canada. We're also able to be much more agile working with other players in the federal system. Right? So with Health Canada, with Canadian Institutes for Health Research and others to start to overcome some of what we perceived as barriers to serve the needs, whether that was for SMEs or for solutions for PPEs. So thank you, I'll stop there.
Thanks, Melanie. Milton?
Oh yeah, I think in our country, actually, as I mentioned, we learned a lot from the SARS pandemic. So we know how to respond to this crisis, because we lost a lot of lives, at that time. So we launched the Central Epidemic Command Center. So they coordinate everything, even the resource allocation. Okay, So and our people also knows that they have to help each other to live together. And regarding the international collaboration, I totally agree with that. International collaboration is very essential because we live on the same planet. Okay, so no one can really get rid of this crisis without collaboration. So Taiwan also try to share our resource and experience with the world. Or for example, we share some face masks with many Western countries who were really suffer from this disease early this year. So even now, I believe our government is still willing to help the world fight against this disease. That's why they also launched a slogan. Taiwan helps. So yeah, we are willing to help. That's my point. Yeah, thank you very much.
Okay, thanks, Milton. Very helpful.
Yeah.
And so we've pivoted. We are looking at maintaining some of the good things that we find, and maybe Will, from the industry perspective, you could share some of the things that you're hoping will be lasting from across the world, not just in Canada.
Sure. Well, I think supporting innovation to further buttress these pivots and paradigm shifts that the global health products industry have taken as part of the COVID response. I think that whether it's Operation Warp Speed as one example, there are other examples out there where it really is, as our panel guest from Taiwan indicated, it really is a global environment. We really have to think globally and act locally. I know it's a cliche, but it's absolutely key. I think that's happened. Even the way ardent competitors in the pharmaceutical industry have gotten together to share information, it can be done. It can be done in a way where one can still protect intellectual property and one can still protect one's own market share. But these companies are realizing that with the right support around the innovation, with the right subsidies, with the right programs, with the right focus, things can be nicely accelerated for the public good, ultimately, where safe and efficacious products can be developed and commercialized successfully and get into the hands of consumers. And I think prevention is just as important as therapy. And there's a real appetite now more than ever on the prevention side for consumers around the world. They want access to these products and they want to feed themselves and their family accordingly, whether it's healthier food choices, a vitamin regimen that they never considered before. I mean, I know folks that would never don the door or cast a shadow in the vitamin aisle of a grocery store are now taking zinc, vitamin D3, vitamin C, other related products, elderberry, things of that nature because of COVID. And I think that's really important to continue. And it'd be really interesting to see the health economic impact of people focusing on integrative wellness and prevention, not just waiting till they're 65 with heart disease to wake up and go on statins. I think that is something that is a positive that can come of this.
Thank you, Will. It's very, very helpful. Now, some of the questions from the audience, one of them is around misinformation and how it's playing out in social media, mainstream media. Us in North America, of course, we seem to see a steady diet of it coming from the United States. And so there's pressure on vaccines. And I know this is a little bit politically charged, but do you see for each of your organizations a role to try and combat misinformation and to focus on science? And I'll just leave it open for someone to raise their hand who'd like to take this one on. Nobody. Oh, okay, David. Yes.
Yeah, I mean, it's a really good point, Dave, and a good question. And I think for UK research and innovation, one of the things we did fairly early on was on our website put up information for the public around the science. So really easy to understand information about the science. So I think it's difficult in some ways to counteract the misinformation because often there's so much of it, and it's fast moving on social media. So you almost need perhaps more regulation and control around that. But I think for UKRI, then actually putting out information on our website, which was very much public facing around these are the basics you need to understand around the science, and be really clear about that, I think just helps. And then you just point people to that and say, if you really want to understand this, then here's some easy to understand information, and try and do it that way. Really, I think it's probably the best way.
Yeah, just a quick note on that, David. I would say that with multivariant issues of any type, I think that it's really, we have more access in the palm of our hands, the individual consumer does, than I think a US president would have had 12 years ago. The access to information, a 10-year-old in South Sudan has more information available to them than the President of the United States did 15 years ago. So you can do the research to look beyond the headlines. And I think with these multivariant issues, a univariant headline typically is not very helpful. So to me, understanding, I think defining, let's back up, defining the various categories of how patients are triaged and what is a positive test versus an actual case versus a hospitalization versus ICU versus death from COVID, population rates, general pop, of those who get it, how many pass on, of those who get it, how many get it again, and what's the level of severity. That's where I think a lot more standardized global definitions could occur to give the consumers good information so they're informed, but not so much information that it's overwhelming.
Thanks. Okay, Verena, and then Melanie.
I think, or let me ask something. For your countries, I suppose all of you have like a central pandemic advisor to their national government. At least in Germany, it's like this, and you mostly see this one person on TV, which is on the one hand quite well, everyone knows this person, but I think on the other hand, it also gives conspiracy theories or people who really want to see everything negative and criticize one focused target they can shoot at, let's say, on social media, on wherever. Even we have a lot of demonstrations in Germany. Though I'm sitting in Brussels, I follow closely the developments in Germany. We have a lot of demonstrations now against all the COVID measures. And I think what we probably need more is a bit more openly scientific advice from a group of scientists who would really bring those information together. What was I agree with what William said, like very focused information, but not just from one person, or not just presented from one person, or just presented by one person, but it needs to be sure that it comes from a wider group of people, because then also the experts, they go to the nightlife or to the talk shows and they fight openly about their opinions, and then no one can really follow it, and the public wouldn't follow it, or it's difficult for them. So a bit more scientific discussion, but openly and really transparent for the people to understand.
Thanks, Verena. Melanie,
quickly. That would be my conclusion.
Great. So I won't touch on the general public information as much as just to say that NRC has in fact put in place a bit of a support initiative to triage a lot of requests, and we've had over 900 request triage related to certification standards, information, and looking at working with NRC. And of course, we're also the metrology organization for Canada. So we've been involved there with looking at real certifications around masks, helping with ventilators, and connecting the dots into Health Canada for firms to ensure they have the right information.
Thank you, and we're just about out of time, so I'd like to take this moment to wrap up. First of all, we've heard from each of the organizations leveraging some from the past, the experience of SARS in Taiwan, rapidly pivoting to address, each organization rapidly pivoting to address the scenario as it unfolded, coming up with new and innovative ways of supporting their constituents in their country, and work internationally as well. And so moving and thinking and listening to how things may evolve in the future as a vaccine becomes available, and how the international scenarios will unfold. And so we've had a nice summary of the changes that each of these organizations and our company have had to adjust. And with that, I'd like to thank all of the organizers of the CSPC 2020 event for allowing us to have a panel like this today, and for all of the folks who are working in the background and helping us out to move forward. And with that, thanks to all the audience who listened to us today. And thank you, and bye now.